Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Happy Thursday, everybody. Happy Q&A day. We can go to our first question.
I think I should be pretty quick. I just have a couple quick questions around kind of my anti-inflammatory like nighttime routine. For a while, I was taking so every night I take 200 milligrams of magnesium, a little bit of melatonin, and then for a while I was also taking 400 milligrams of Advil every night. And I decided I should probably stop taking the Advil because it had been quite a long time of doing that, and I know that it's not necessarily meant for that kind of purpose. So I've just been looking to see what sort of thing, because I did find the reason I kept taking it is because I did find there was quite a bit of a difference in how I woke up the next morning if I had taken the Advil. I just found it was kind of sometimes if I had a bit of a rough day in terms of symptoms, then I found it did a better job of resetting me back to kind of baseline the next day. But I've gotten to the point where things are actually starting to progress a decent amount, and so I decided to try not taking it. So I haven't taken it for about a week, and it's been okay. But I just was trying to think of other things I might be able to slot in there that could have a similar effect. One that I just added into my routine is curcumin, and that's been, I just started that yesterday, but it seems like it'll be a nice little fit. One question I had was, it should be a quick one, is just what's kind of the limit on the magnesium? Like I'm taking 200 milligrams, but like, is that what you'd recommend for night, or can you take 400, or they're 200 milligram capsules?
Yeah. Okay. So good question. In terms of magnesium, the recommended dose based on the research, this is what the research shows, is somewhere between 200 and 400 milligrams.
That's what I saw. Yeah.
Yeah. So you are absolutely fine with taking 200. Some people benefit from taking a bit more. Now, if you take more at one time, there's a greater chance that it just causes loose stools. We know that at higher doses, magnesium can cause a laxative effect. So that's really what you might experience. Now, 400 milligrams is something that's tolerated by a lot of people, but I would say it's kind of on the upper end. If you have sensitive digestive system, more predisposed to loose stools, that might be too aggressive. The other thing to consider is that 200 milligrams magnesium per capsule most likely is magnesium. Is it magnesium glycinate that you're taking? Or oxide,
so. I think it's the glycinate. I'm going to see if I have a picture of it in my phone, and then
yeah, it most likely is glycinate or oxide, because I know that in order to get up to that dose, you need to actually use one of those two forms. And so what that means is that you are probably going to have a little bit of extra loose stools if you're using oxide. And the most amount of magnesium glycinate that is 100% pure, meaning that there's no additional mag oxide mixed with the mag glycinate, is about 100 to 120 milligrams. So if you're having a 200 milligram mag glycinate, it has mag glycinate in it, but there's a percentage of it that's actually coming from mag oxide, meaning it just is easier to get a laxative effect if you push up to a higher dose. That's what I'm saying. It's not like you're harming yourself or anything like that. So again, probably better served by breaking it up during the day, and that's going to optimize absorption. And then I think you're right on track with turmeric or curcumin, looking for kind of a brain specific form of curcumin.
Yeah, I have the Mariva phytosome.
Yeah, so that's the addition of the phytosome, which is kind of just a fancy way of saying they've combined it with a little bit of fat to help improve bioavailability and absorption. That I think is probably the leading alternative in the natural health product space to what maybe an Advil would do. I think you could probably try the phytosome for a while. Then there's another one. I'll write it in the chat. This one's called Long Vita, and this one studied at UCLA, that for having an ability to get into the brain, it has a bit of a different technology. I would say it's probably a cut or two above the
I think I saw that one when I was looking around as well.
Yeah. So that one I think is a good candidate. And again, playing around with a dose there. Usually the evidence-based dose is around 400 milligrams at one time, and you do that 3 times a day. But if you're only taking it in the evening, you can do 400 milligrams, but you want to use one of those bioavailable forms, because they, in my clinical experience, they do make a big difference. Right. So I think otherwise you're on the right track. If you're trying to get the anti-inflammatory effect, one final point: omega-3s sometime during the day would.
Yeah, I'm taking those too. Yeah,
would be a good idea. Okay.
Yeah, I'm not taking the curcumin just at night, but so I kind of didn't quite 1-to-1 replace it with replace the Advil with that, but I started taking the curcumin at the same times as the omega-3s because I heard that is also good for absorption.
Yep. You can definitely do the break. Like, you can break up the dose of the curcumin, but if you really for anyone that's listening, people that have symptoms that are worse overnight, like pain, if they have some sort of nerve issues that are happening overnight, some sort of impingement, their neck, maybe they're having trouble with brain fog when they wake up in the morning, trying that before bed, like you were doing with the Advil, could be a decent alternative.
Okay. The other kind of second part to this, and I know I don't intend it to be like a medical advice type question, but it might kind of feel like it's delving into that range. But I'm more so just wondering your guys' opinions on it, if you've seen any research on it. Have you guys seen any studies on the use of CBD for concussion or post-concussion treatment? Because I know it's kind of it's good for calming and reducing anxiety, and it's also anti-inflammatory. Mm-hmm. So I was wondering if you guys have seen anything in terms of that, because that's something I've been thinking about might be a decent replacement for the Advil as well.
Yeah, that's a really good point. In fact, in the 2.0 supplement module, I actually have a module that I talk about CBD a little bit.
Okay.
And I do detail that there is some animal studies showing the anti-inflammatory benefit after a concussion of cannabis, specifically the CBD, the cannabidiol. Right. Now, I would say CBD has a little bit more, not as much research on it as some of the other things like creatine and omega-3s and turmeric. But I think for some people that it works well, it can be a very good alternative. It's not for everybody, and definitely if a person's taking it in the cannabis form, if you have anxiety or depression, it can definitely make that worse. So if you're just looking for kind of straight CBD, it could be a really good option for people that respond well to it.
Okay. Thank you very much.
Welcome. All right, let's move on to.
Yeah, so I had a couple questions, mostly around just progress I'm making, and then with a recent flare-up. So about 2 months ago, I started seeing a chiropractor for manual therapy regularly, and then about a month ago, started seeing him twice a week, because I was seeing progress right after the appointment, but then backsliding by the time I got halfway through. And in doing that, I started seeing some actual progress for the first time. So I know there was some help there. with that manual therapy part. And part of the reason I was thinking it was the neck, and I came on to one of the other sessions and talked to Dr. Cam about it, was exercise actually makes me feel better. So it was kind of like loosely making me feel better like early on last couple months. But then like this past month, by combining the manual therapy and exercise, I can get like really good short-term relief whenever I go and do exercise. So I've been on a stationary bike program since like July with the other clinic I'm working with. And so I'm doing interval training there, and I've been getting up to like 180 beats per minute without really any issues. And like for 20 minutes after, I'll feel like there's been like twice I could say I felt really good for the first time since getting the concussion. And then like symptoms start to come back after that 20 minutes after exercise. So that's like how I can get short-term relief through it. And then so now kind of talk about work. I was working probably around I was working 5 hours per day, 5 days a week through July and August. I never really took prolonged time off from work on the advice of the other clinic when I got it. So it was work as much as I can. And then we got to a point where I was working 5 hours a day. And then I think in August, early September, I tried 6. Didn't notice a change in symptoms. And then recently did 7 hours and didn't really notice too much of a change there. And then there was one point early in September where I had a really bad week and then got treatment done. And then I had the best week that I've had. So that was kind of like, now I want to try and go back into the office. I've been working from home for the past 4 months. So first time going into the office, felt good. And part of the reason I figured it might actually help me is because I'm getting away from my computer and from my desk. I'm moving around more, kind of just more natural day and flow. So I felt good while I was in the office, maybe a little bit of fatigue around noontime, and then just noticed some like jaw tiredness in the afternoon, probably just from talking so much. But then the next day I was just crushed. Like I had all the symptoms that I was having before. Like some of them were even as bad as they were early on, with just like extreme fatigue, headache, dizziness, lightheadedness. I was having just like chewing and talking. My jaw was tired. I could only get through like 2 to 3 hours the next day at home. And it kind of stayed like that through the weekend, got a little bit better over time. And now at this point, I'm, a week out from that. Now I'm kind of getting back to more the normal self there. So like part of the question I'm wondering is like kind of what was the trigger there? Like I was thinking autonomic nervous system isn't too much of an issue for me, considering how much I tolerate exercise and that it works well for me. So I don't know if it's like just a too much at once there, because the other thing is like I've had events where I've had to go to weddings, drive like 2 hours, and been like mostly fine through some of them. Some of them kind of I get an increase in symptoms there sometimes. But like one of the weddings I had a couple weeks ago, I went to and had a poor week leading up to it, but then like after an appointment felt pretty good, and then just kind of just enjoyed myself at the wedding. Even had like a couple drinks for the first time, and then I went on to have like the best week I've had so far. So it's just kind of like I was not expecting just going into work to be so crushing for me for the next few days. I did yesterday, one of my doctors I'm seeing did look at TMJ. So we looked at the lateral pterygoid, and it was tight and very painful when he pushed on it. So we did some stuff there with that and one of the muscles on the top of the roof of my mouth. So I'm wondering if that could be kind of part of it. And then one of the other parts is the headaches have been coming down with the manual therapy work. But I've been noticing more. I don't know if it's because the headaches are coming down that I'm noticing it more, or if they're just kind of going up a little bit, is dizziness and nausea. Like that's like now it's kind of switched where dizziness and nausea is just the more bothersome symptoms that I have versus the constant headaches. Headaches are still there, but they're much less. So yeah, that was kind of, is ANS something that's still there, or could it just be like the muscles in my neck need to be more stabilized? Oh, and the other part is I never really had pain in my neck, like through the first few months when I wasn't getting manual therapy done. But once I started getting manual therapy done, then I started having like a sore neck throughout the week and just kind of more pain there and some in the back. And even like when I exercise, I can get that pain away in my back to go away. And even through this recent flare up after going into work, I went to the gym Friday, got some relief. And then again, Monday when I wasn't feeling good, like go to the gym after work, and it'll just like help me a lot. So I know there's like something there that's helping give me relief, even when I'm having the flare up.
Okay. I mean, there's a lot to try and unpack there. So first, I mean, let's talk about like autonomic. So I'm just going to share my screen here. Can you see this?
Mm-hmm.
So you got to think of autonomic as on a spectrum. So, in the severe state, you have orthostatic issues where even standing up is going to flare symptoms. In the moderate realm, you're exercise intolerant, but you're not. But then if you still can have some mild autonomic dysregulation where you have increased symptoms with cognitive load, especially if you overdo it.
Mm-hmm.
So autonomic still could be an issue, right? You're fine at home, and then all of a sudden you go to the office, there's a lot more moving parts. You have to be on, I guess, a little bit more because you're involved in regular conversations. You may feel fine at the time, but it's just kind of like you overdid it the next day, you feel that, crash. So I still think autonomic could be a factor, but it could be a whole bunch of different, whole bunch of different things. But autonomic is still there. In terms of the neck, so I'm just going to stop sharing here, but in terms of the neck, when somebody feels really good after exercise, there's a couple possibilities for that. So one is that you have a release of endorphins after you exercise, and it's going to elevate your mood. So if you have, depression and anxiety that are driving some of your symptoms, exercise is one of the best antidepressants and anti-anxiety tools that we have. So it could be that after you exercise, this release of endorphins elevates your mood and therefore you feel better. The other possibility is that when you exercise, your body temperature increases. When your body temperature increases, muscles that are tight relax, right? What do we do to release a tight muscle? We use heat, right? If you go to get a massage, they're going to put you on a heating pad. They're going to put all the blankets over you and make your body nice and warm as they do the massage because heat relaxes muscle tissue. So if your symptoms are neck related, I often see this when I'm working with patients. They'll come in and they'll have these symptoms, and then we'll put them on the treadmill, and then I'm asking them about their symptoms while they're on the treadmill, and after they've been on there for about 10 minutes, I feel better. I actually feel like my headache is getting better and their symptoms are going down while they're exercising. So to me, usually that's kind of a telltale sign that their neck is involved probably, right? Especially if the symptoms are headache and dizziness and those types of things. Now the other part of like symptoms kind of switching, right? Like if you get manual therapy, you're going to be sore after, right? It's almost like if you have a workout, you're going to have like delayed onset kind of muscle soreness, right? So if somebody's going to work on your neck and they're getting it on your tissues, yeah, you can be a little bit more sore in your neck after you get that done. That's kind of normal. You're going to have increased inflammation in the area, so you're going to want to make sure you're hydrating, you're taking your magnesium, you're paying attention to your diet, trying to get good sleep. The symptoms switching can happen as well because headaches can come from just straight up like muscle tension, right? So if I have a lot of tension in the suboccipitals, for example, that can cause a headache. Now, if I release those muscles, the headaches can go away, but then by treating other muscles in the neck, potentially you create just imbalances from side to side, and that can start to increase dizziness a little bit. So you can have this shift in symptoms. It still sounds like there's quite a bit of neck involvement in your case, potentially some kind of mild autonomic, which is the symptom flare with that cognitive loading at work. Yeah, so there's kind of a bunch of different pieces here. Does that help you at all, or do you have more follow-up questions?
I think so, yeah. And I guess just so I've been going like twice a week to get work done on my neck for probably 3 weeks now. And before that, like it was just once a week for like 4 weeks. And it's kind of like I saw a lot of good progress at the front, and now I'm kind of hitting a point where it's like just kind of staying the same, like not as much progress at this point. So I'm wondering, is it more stabilization now that I'm loosening things up and that things need to get stronger? Because otherwise, like I watched one of the seminars you had, so I'm wondering like when my traps are like starting to feel really painful, I'll get more headaches. So I don't know if I'm just having those other muscle groups take over because my stabilization muscles are just too weak.
You could also be experiencing a phenomenon that I see with patients where you initially, when you're doing kind of the work that we talk about in the Fix program and the stuff that you're already doing, you kind of have the initial easy improvements because you're just doing a lot of the basics. And then you hit like, once you get to kind of like 80% resolved, you hit like another plateau. And usually as your symptoms lessen, people do more. So they, like you said, they go back to work, and now you're challenging yourself in a different way. And so your perception of your progress is that it's slowed down because you have more symptoms. But when you look at it in reality, your functionality, if you're graphing functionality versus symptoms, yeah, your symptoms initially went down, but they kind of went up, but the functionality goes up. And as you're increasing functionality, you're building neuroplasticity. So you do have to kind of, I think, push through this. Again, this is more of a macro comment. And, I don't know if Cam, you have a bit more of a micro insight onto that.
No, I think that's common, right? Like
Yeah.
You start feeling better, you start doing more, and then that trade-off starts to happen, right? Where it's like, okay, I'm just kind of stagnating where I am. And then it's just trying to figure out how to unlock that, right? So sometimes, especially when it comes to manual therapy, if you start to hit a plateau, you may have just exceeded the level of that practitioner to get to the right spots. You may just need to try a different set of hands, right? And I see this with my patients sometimes, is that I'll get, and all of a sudden they're just not improving, and I'll say, you know what, let's try osteopathy or something. So I'll send them to like a completely different type of treatment, and that might be something that unlocks for them. Right? It may not do anything, or just a different set of hands sometimes can kind of move you beyond that plateau.
Yeah, that makes sense. And I think what you said, Dr. Hrkal, about the progression versus symptoms is also probably really true.
Yeah, it especially happens with work. Like that's the number one place we see it most often, because we usually, before we go back to work, like that's our goal. We want to get back to the way life was pre-concussion. What we try to encourage you is saying there's probably things you're doing at work, in life, that probably was stressing you in a little bit more of a way that now you're sensitive to. And when you go back to work, you're never quite ready before you actually go, because it's almost impossible to recreate it perfectly with the types of breaks and rests and things like that. I like this. I like this graphic in terms of treatment volume and time. It's pretty common to see this type of pattern where you have improvement in symptoms, but you have some of the rehab that's changing here. So just I'm going to say be patient with yourself, because some of the things that you were doing previously, they sometimes, you kind of reach a max and you have to kind of pivot your treatments a little bit. That sometimes happens. Or you're just doing more and your systems, you're now challenging multiple systems and they're being a bit more overwhelmed. And you kind of just have to stay in that, I call it kind of like a burn zone, as your brain and nervous system just become rehabilitated and kind of grow. And that's where that neuroplasticity comes in.
Yeah. Yeah,
So
that makes a lot of sense.
Just talking about neck treatment, you're asking like, oh, should I start stabilization now? I think the next step, especially because you're having some dizziness, is the proprioception, right? Because that's what's going to integrate vestibular, eyes, and neck together. And that's kind of what you want. So it's like your initial treatment, right? You're going to get this massive drop. This is symptoms here, this line. So initially, you're going to get this great drop in treatment with manual therapy. And then as it starts to kind of level out, now that's when you want to start continuing to do manual therapy. But then your treatment kind of shifts from like a bit of manual therapy now to more a proprioception, right? Where you're doing like eye-head movement coordination things. Like, I don't know if you're at that module yet, but like slow head turns with your eye, like your eyes looking at a target, for example, but doing it slow to integrate that. The laser thing on the head where you turn side to side. Are you going to a concussion clinic?
Yeah.
Yeah.
So I was doing similar types of exercises for a while, but I kind of paused them when I was having, like, I wasn't really seeing an increase. This was before I really started the manual therapy stuff. So I think now would probably be a good time to start those again.
To go in, yeah. Yeah, so go back and revisit that, right? So you didn't have the manual therapy first, and oftentimes that's just going to flare things up because the neck is the issue and you haven't properly addressed that. But then once the neck is starting to kind of calm down and those symptoms are improving, now it's like, okay, now we got to go proprioception to start helping the head and the neck and the eyes and the ears kind of work together. And then as things improve even more, then you start working in with stabilization to say, okay, now things are pretty good. Let's work to keep them there to prevent things from coming back.
Hmm. Yeah, that makes sense.
Yeah.
And then
The other thing to consider too is usually I start with once a week. I'll go to twice a week if the person, and you can tell me if this is your case. If I see you on Monday, for example, and then I want to see you again next Monday. If you come in next Monday and you're like, "Well, I felt great for like 2 or 3 days, and then my symptoms started coming back," and then I do a symptom score with you the following Monday, and your symptoms are basically the same as what they were when I first saw you on the previous Monday, right? Because what we're doing there is you're getting better, and then by the time I see you again, you're back to square one. Then you're getting better, and I see you again, you're back to square one. In that case, what I'll do is I'll increase the frequency of visits to twice per week because I want to see you when you're still doing good. Before you've all come all the way back down to square one, I want to try and build on that to kind of get you over that. Now, if I'm seeing you twice a week and I see you on, let's say, Monday, Thursday, you come in on Monday, I treat you, I see you Thursday now, and you're like, yeah, I still feel pretty good. I'll treat you on that Thursday, but then I'm going to move you back to once a week.
mhm.
So, because if I treat you too frequently, sometimes you're still sore from the previous treatment, and now I'm just beating up tissue and I'm not allowing it to recover fully. Right? So it's
Yeah.
this kind of fine balance where if you're, feeling really great for 2 or 3 days, but then you're kind of leveling off or coming back down to square one, I will increase frequency. But if I'm seeing you twice a week and you're still sore from the previous treatment, like your neck is sore still from that treatment, I don't want to keep treating you because I'm just beating things up. So maybe twice a week is too much for you. Maybe that's the right amount. I don't know, but you can tell me why the frequency was increased.
Yeah, it was because I could go like 2 days of feeling good, and then it was kind of going
Okay.
back to normal.
Right. Okay.
And then when I went to the 2 days, I started, that's when I finally kind of made progress. Where by the time I'd see him again, I was going
Good.
up. So maybe
Okay.
I should get going down because not. And sometimes it's not even just soreness; it's more just like tightness, and like I'll get like a sharp pain in my back around my shoulder blade.
Yeah.
But then like this week when I went and exercised and that went away, that was, interesting to me that I was able to get it to go away on my own without going in for treatment.
Yeah, and that stuff, like, that could be all just like functional postural stuff. So now might be a good time to start with the proprioception and some of the postural strengthening exercises
Mhm.
to reduce that type of stuff. Right? So you might be in a good place right now to have this shift starting where we're reducing the amount of manual therapy, we're increasing the rehab side.
Okay.
That might be what allows you over that plateau.
Yeah.
Okay?
And then I had a question about TMJ real quick if we have time. Does that need multiple treatments to like help go away, or is that kind of like a one? Because I got some work done yesterday, and so it was definitely tight.
Yeah, I mean, and it's so related to neck. So what I've started realizing over the past few years only is that a lot of times people that have this like neck tightness that I'll treat it and it'll come right back, I'll treat it and it'll come right back. A lot of times it's related to TMJ. And when I start treating the TMJ, those muscles can relax. But I incorporate that at every visit. So when I see a patient, I'll do all my kind of soft tissue stuff and then I'll go in with my finger into the pterygoids. I'll work on their masseters and their temporalis muscles. I incorporate that as part of my treatment and I do it with every single neck related patient because it's so involved. But yeah, you're going to need a few more treatments on that for sure.
Okay. Thank you.
Yeah. All right. Next up is
Put in the comments, Cam, that you had suggested that they come in as they had questions about guidelines for exercise and autonomics that they messaged you about.
yeah. And that's, I'd like to
Yeah.
have them talk to it so we can actually get down to the
Oh, they're saying if they want to ask it in the chat that they're here.
Okay. So they maybe don't want to talk. I'm happy to answer some of the questions that I got from them as well, if that's helpful. But basically, it's an interesting request. They found that the letter that we provide for the testing made a big difference, apparently, with their healthcare provider. But they were also asking about a letter to kind of describe the gut symptoms, the connection between concussion and digestive issues, and also about the evidence around the anti-inflammatory diet. And I actually think that's a reasonably good idea, just to kind of maybe give whoever they're working with a bit more context. So that's something that we have not yet created. We'll take that back to add it to the list of things that I think could be additional resources, but that's good feedback.
Yeah, I got the question here in the they sent it to me on the platform.
Yeah, that's what I was looking at too. Okay. Do you want to answer it?
Yeah, but it's like 6 paragraphs long. So basically they're having questions about exercise. They're doing HIIT training right now, and that seems to be working well.
Yeah.
However, in the program we recommend steady state cardio. But when they do steady state cardio, they have symptom flares, but they're thinking that that's because of neck and potential visual issues. So their neck and visual issues cause symptom flares before their autonomic nervous system kicks in. Because when they do HIIT training with weights, they're able to do it and feels that it helps them with other things like allowing the nervous system to relax, feel much better in the days after. And so they're hesitant to switch from high intensity interval weight-based training because they feel that it's helpful for them, and it feels that it helps them in like a number of other ways, like good mood and energy. Mm-hmm. So here's the thing: if you're already doing HIIT training and you feel fine with it, then continue with it. So we're not telling you to stop. The reason why we start with steady state cardio is because it's easier for your nervous system to deal with. Your nervous system, when you're doing steady state cardio, it's easier for your nervous system to deal with a steady heart rate below symptom threshold, and then gradually increasing that over time. That's an easier thing. HIIT training, when your heart rate spikes and drops and spikes and drops and spikes and drops, that's harder for your autonomic nervous system to deal with. So when we say steady state cardio, the reason why we start there is because most people are blowing their threshold trying to do HIIT training, and they're actually holding themselves back. But usually that's accompanied by symptoms. Hey, every time I exercise, I get these symptom flares and I don't know what to do. The answer is you need to stop with the HIIT training and stop with the weight training and go to steady state cardio. But you're already kind of at that next step where you can do weights, you can do kind of more, HIIT training, and you don't have those symptom flares and you actually feel better. That's fine. So you can continue that. That's fine. You're just at the next step. You're at the next stage of the progression, and that's good. So don't stop what you're doing as long as it's not flaring your symptoms. And then I don't understand this last question. My third question is about the 3 out of 10 increase in symptoms, specifically when symptoms increase mainly after the workout. In the case of exercise prescription without exertion testing, when you reach the stage where you have 3 out of 10 in symptoms, you drop one stage and stay there for 2 weeks. Is this a 3 out of 10 during the exercise? I notice that my symptoms often get worse after and sometimes only come after the exercise. After, if you have a symptom increase after, it's the same as during. So if you have symptom increase after your exercise, it means that you've blown your threshold. So it means you need to dial it back a bit. But then what I'm kind of confused here is you say that you get symptom flares after HIIT training. If that's the case,
Yes.
then that's not what you should be doing.
Yes. Is my audio working now?
Sorry?
Is the audio working now?
Yeah.
I try to switch
Yep.
on. Yes. Yes, I do get a flare in symptoms later, so I get really, really tired in the hours after the workout. But during the workout, it's kind of okay as long as I do the HIIT like 50 seconds on and then take a break. So it doesn't seem to be the heart rate that's the main driver of symptoms, as long as I take a break every so often to kind of like calm down. But it does lead to fatigue later.
I mean, fatigue is also just exercise. Like I get fatigued if I do a hard workout.
Yeah,
That's not really a concussion thing.
No, but way more fatigued.
Sorry?
Yeah. So I've been working out like all my life, and then I got like a little fatigue, but now I'm really fatigued. Like it's really hard to do other things the rest of the day. So I can do like a workout in the morning and then one other activity in the afternoon. But it makes it much harder to combine workout with other activities. At the same time, I get really tense and stressed and I'm sympathetic a lot when I don't work out. So I find it hard to release that stress in another way.
Yeah, but if you're having symptom flares after your workout, it means you're working out above your threshold.
Okay.
And it's
Yeah.
really hard to control your threshold with HIIT-based training. It's a lot easier to look at your wristwatch and have your heart rate steady state. That's a lot easier, right? And now your concern is that you get a flare in symptoms when you're exercising, but you think it's due to visual or neck issues. Well, that's actually kind of therapeutic, right? Like, what's the treatment if you have visual motion issues, right? You have trouble with visual motion stuff. What's the treatment? Well, you expose yourself to visual motion and then it gets better. So it's kind of therapeutic in a way to do that. But really you want to isolate those variables, which is why we recommend starting if that's bothering you, it's like trying to start with stationary biking or a treadmill. Now, you said you don't have a stationary bike or a treadmill, but could you get a membership to a gym or something where you could do something like that? That I think is the best way to do it, because then you can isolate those variables, get rid of it. You're focused purely on autonomic. And then you know that if you do have a symptom flare, if you are exercising outside, that it's just visual or just neck, and that's fine because that's actually therapeutic for you. Do you know what I mean?
Yes.
But if you don't know if it's visual or neck, and it could be autonomic, well, then you don't know if you're actually just flaring yourself up and actually setting yourself back or not. So this is where it gets confusing, right? Because if the HIIT training's flaring you up after, it means that you're blowing your threshold. But also it could be because you're doing weights and you have neck dysfunction, and the weights, make your dysfunctional neck more dysfunctional. So again, we don't know which one of those is the cause. So that's why steady state cardio, figuring out what your threshold is, and then isolating and eliminating those other variables. That's kind of what you have to do. So you have to find a way to do that.
Okay. And if I would do something, for example, like more continuous Pilates with resistance bands or something like that, because then I can control my heart rate, but I feel like I bump into the neck and the visual issues way less because I'm, for example, laying down or working out on a mat or standing still instead of walking, which seems to aggravate the symptoms so much quicker and higher. So then it feels like I bump into the neck issues before I really isolate the potential autonomic problems.
Yeah, see, I don't really even like that either, because how are you going to keep your heart rate completely stable? And then these resistance bands, if you're doing any type of, overhead work or shoulder work or arm work, your neck is going to be tensing while you try to lift and do those resistance moves. So then is that aggravating your neck? Is this really getting to your autonomic, or is this a neck issue?
Okay.
Right? So it still makes it confusing. I think the protocol is steady state cardio with eliminating visual and vestibular and neck if that's an issue. So it's either sitting on a stationary bike, walking on a treadmill, whatever, where you're in a confined space that you're not seeing all this visual motion stuff, because then you can really isolate autonomic. You build autonomic, and then you move, once your autonomic is good, then you can move to Pilates and other types of things that you enjoy doing.
Okay.
My first understanding was that you felt good with the HIIT, but then I'm
Yeah,
reading.
during.
Yeah, during.
Yeah.
But symptoms after is the exact same as symptoms during.
Okay. Thank you. Yeah. And what would you advise on? I dropped out of the meeting a little bit to adjust my microphone settings, so maybe you explain this. I'm sorry in that case, but what would you advise for the tension in my body? Because this is pretty much the only way that I found during my life that really works. So meditation does seem to calm me down, but in a very different way, and it still seems like all the tension and the stress is still in my body and in my muscles, and it's only the resistance bands or the weights that really help it release. And I get very bouncy, and it gets more and more and more over the days and the weeks otherwise. So I haven't really found another way to deal with that. So walking and cycling doesn't really solve that.
I mean, you could try the HIIT, but just reducing the intensity for a bit, and see if that kind of does it. You could also try to do mostly steady state, but throw in a HIIT workout once or twice a week, so that you're not doing it every time.
Yeah, it feels like a difficult dilemma. Yeah, because the
Yeah, I mean,
guidelines are very clear, and
I still think that exercise in general is going to be helpful for mood and that type of stuff.
yeah,
And so I
exactly.
still think that you are going to get the same benefits doing, steady state cardio. Especially as you start increasing your tolerance to it and start working at a higher heart rate, then you're going to get, that same kind of relief with that exercise. At the first part, it might not be, because your heart rate might be so low that you're not actually like creating that, endorphin situation. But I still think that's the protocol, because if you're just doing HIIT training and it's flaring you up after you work out every day, you're actually holding yourself back. You're plateauing yourself, and you'll never be able to break through that barrier, because you're just hitting a wall every time, and it's gradually pushing you back and back and back. And so I don't think this is helpful for you.
Okay.
So
Yes.
I think just switching and going, okay, I just have to do this steady state. And if you want to throw in, a Pilates or like one HIIT per week or something to try and, balance that, then that might be a good solution for you. But you just don't want to be doing like HIIT workouts every time if they're flaring you up.
Yes. Thank you.
Does that make sense?
Yes.
Okay. Do we have a couple chat questions, Nikki? Yeah.
Yeah, we've got one question in the chat here that we can get to. I'd like to hear your thoughts about medication and or Botox. My neurologist mentioned it as well as an antidepressant called nortriptyline, 10 milligrams daily. He said if I continue to struggle with headaches, I could consider meds. I've been doing everything else: meditation, sleep, nutrition, exercise. This would be a last resort to improve my quality of life and be able to return to teaching full time.
Yeah, I'll start, Cam, if you have anything to add.
Well,
So
first, I want to know, because I think she posted this on the newsfeed as well. My first
Mhm.
question is, where is she in the program?
right. Yeah,
Like,
so I mean,
she
she
says,
hasn't
I've been
found
doing
it at the
everything else: meditation, sleep, nutrition, exercise. That doesn't include any type of neck work. I don't see on her list there. Like, where is she in the program? If she's still here, can she tell us?
Yeah, no, she had to leave already.
I mean, maybe, yeah, if she can respond on the news feeds. Most often, this type of pain is, again, the neck is the key piece that needs to be addressed.
Right.
That's 100%. So I'll say this for anyone that's listening, and for this particular member: Botox can work. It's same with the nortriptyline. These are antidepressants that have anti kind of nerve related pain effects. They're meant to be last resort, which is kind of what they're saying. Is this person exhausted all other type of care, manual care, acupuncture, osteopathy? Yeah, those are the top three that come to mind. TMJ work, internal mouth work, craniosacral evens. There's all sorts of non-invasive things. Once you go down the Botox route, you're kind of stuck on getting that repeat every 3 to 6 months, right? So
Yeah.
it
And there's
what
also
it does is blocks the
and there's also side effects to that. So a lot of people, because the whole thing is that if you're getting Botox, what is Botox doing? Well, Botox is a toxin that basically paralyzes muscles, right? That's why they use it for wrinkles, because they'll paralyze the muscles that actually squinch to cause the wrinkles, and therefore you don't have wrinkles anymore for 3 months. Then you got to do it again. So if they're paralyzing muscles, where are they paralyzing those muscles? They're typically paralyzing them in the neck. So what happens, given the amount of input that comes in from the muscles of your neck to your brain to tell you where you are in space, what happens when you paralyze the muscle tissue in your neck? A lot of times patients get extremely dizzy. For that entire 3-month period that the Botox is active, their headaches may reduce, but now they're extremely dizzy. I've had patients that are bedridden with dizziness because of the Botox they got. So it's not without its risks. It's not without its side effects. You also have to think that, okay, if the solution is Botox to paralyze the muscles in my neck, where are the headaches coming from? Probably from your neck. Are there other ways to fix that? Yes, there are. And there are other ways to do that in a way that's actually going to create permanent, like Botox, like any medication, you're basically just blocking the symptom.
For sure.
You're not fixing the problem. So Botox is not a solution. It's temporary relief of the headaches with the risk of causing extreme dizziness for months.
Mm-hmm.
And so I would rather try to fix the problem than just Band-Aid, over it and say, okay, well, now I feel better for a couple months, but now I got to do it again and again and again and again. And we risk creating more problems. So Botox for me is like, unless you've tried 15 different manual therapists, you've tried all these different people and no one can seem to get to it. And you're finally like, okay, I guess we have to do this because it's the only option. Yeah.
I agree. Yeah. It really should be last resort. These medications, unfortunately, like nortriptyline, they're prescribed first line, even though there's no evidence for them for PCS, but they're all symptom management. And that literally is what it is. It's like, I don't want to mess around with someone's neurochemistry, which is so important in things that are not just related to pain that you're feeling. It's actually your mood. It's your energy. It's your sexual function. Weight, that one of the most common side effects of this class of medications is weight gain. And that has a huge knock-on effect on inflammation. So it's kind of like do you want the quick fix or do you want the long-term fix? Again, we're not judging anyone that's on these medications. We've seen them actually be used judiciously to be helpful on allowing a person to maybe tolerate more treatment, to be a little bit more functional. But if this is the long-term solution, then I think the person's really going to be just stuck. They just basically make you stuck at where you're at.
Well, and then the medications, they're hard to get off of, right? You develop dependencies to them. They're
Especially
hard to wean off. So you are stuck. Like once you start going down the road of medications, it makes it really hard because the side effects of many of these medications look exactly like some of the symptoms of concussion. And then it creates confusion in the picture because do I still have these symptoms or are these just medication-induced side effects that are now making me experience the same concussion-like symptoms I've already had? And so that's why we always say, like, let's fix the underlying issue, not just try to mask symptoms.
Yep.
And so she's completed the sleep. I just went in and looked where she's at. She's completed up to sleep section. That's it. So she hasn't. Right. So she still has a lot of the program to go.
So I always find it funny when people say, I've been doing everything. I've already been doing everything, but yet we haven't really. You know what I mean? Mm-hmm. So I still think that we need more time. This person needs to just keep working on some of those areas to kind of build that foundation, right? It's like, yeah, your neurologist mentioned this because that's what doctors do. Their only solution is drugs. So here's the drugs, right? And people assume that's going to be the best solution because, well, this is a neurologist. But what they're not telling you is that that's not going to fix the problem. It's going to maybe mask some of the symptoms, potentially create more problems for you in the future. Whereas the way that we kind of operate is like, let's actually address the underlying issue here and fix it.
Yeah. Okay.
Great. And that's all of our questions for today. So thank you for all those who were able to come on, ask questions, leave some comments in the chat. We always appreciate it. Otherwise, I hope everyone has a fantastic day. Bye.
See ya.
Bye, guys.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit. And don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.